Another radiological modality that has really been useful to cancer patients is PET scans. PET stands for Positron Emission Tomography, where physicians are able to measure the body's abnormal molecular cell activity to detect ailments such as heart disease, brain disorders, and cancer. Northern California PET Imaging Center in Sacramento has been experts in the field since 1992.
Early in our development, the benefit of PET in clinical oncology really wasn't known. It wasn't known to the payers, it wasn't known to the physician, referring physicians, it wasn't known to almost anybody who had been involved. So what we had to start doing was establishing the clinical research and clinical data to support the use of PET in oncology. We also started publishing papers on the cost benefits of using PET in clinical management, because what we found is that because you're able to find disease earlier in the course of the diagnostic process, we were able to save the patient essentially more procedures, but in that area we were able to actually save costs to the healthcare system.
PET scans can be used to determine the stage of cancer, giving doctors a good indication of what they're up against. PET scans can also be utilized for the treatment phase of cancer.
There's several ways you can use PET in the treatment, in integrating it into the treatment of the patient. First, you want to use it to stage the patient to make sure you know exactly where all the lesions are, whether it's just localized or spread out throughout the body, so you can tailor your chemotherapy or radiation therapy to where the lesions are. Another thing is you can use it to monitor tumor response to therapy. Another way of using this after patients diagnosed is to follow the patient through the years to find out whether they have had a recurrence that they didn't detect, because sometimes the recurrences, you don't feel anything. In fact, some patients don't feel a thing even if they have carcinoma spread out throughout their body.
With improvements in technology, PET combined with CT scans have allowed doctors to be more confident in their diagnosis and treatment plans for cancer patients.
Adding CT to it makes you more exact in determining where the lesions are. It helps. It overlays the images, what they call fusion. It overlays a CT and a PET exactly to the cut that you're going through. It's a fantastic step forward.
How do PET CT scans work? Well, a patient can expect to spend about 2 hours in a PET facility like Northern California PET Imaging Center. PET scanning entails of injecting a small amount of radioactive tracer into the bloodstream. A patient must fast for 6 hours prior to the procedure. Following the injection, a patient is required to sit and relax for about an hour. It's important that a patient is calm and relaxed during the procedure. The patient will be taken into the scanner where they will lie comfortably while the CT is performed, followed by the PET scan. All this is done in about 40 minutes.
In the olden days, it used to take an hour and a half, so I think that we've made a lot of improvements and the patient lies comfortably. If the patient needs to have a diagnostic CT scan with contrast, we perform that scan after the CT, then the PET, and then we do the CT scan with contrast. All those images are within one imaging session, which increases the quality of the scan since the patient isn't moving. They're not going from one piece of equipment to the next, so the patient is essentially in the very same position, and we're able to localize the lesions in a much better way.
A fairly new form of imaging has been PET or Positron Emission Tomography scanning, which has been used to help doctors diagnose and treat cancer. A new form of this is called Pem or Positron Emission Mammography, which is used for imaging breasts and other small body parts.
The Pem unit itself is a very high resolution unit that looks at breast imaging, dedicated breast imaging, and allows us to take a look at the metabolic activity within the breast. Now, how that's interesting is that if you look at digital mammography or mammography in general, again, you're looking at anatomical structure, but you're not really looking at physiology at all, and that's what we look at. We look at physiology.
Typically, when something questionable is seen on a mammography, most doctors will turn to MRI,
which can give you a great anatomical image to see lesions with, but still unsure which ones may be cancerous. Pem imaging can help narrow that down.
I think the role of Pem is that we can look at the breast and tell them whether or not any of those things are metabolically active, abnormally metabolically active. I think the greatest uses right now have been trying to determine which findings on MRI are really important or not, or whether they're important or not. Other things that we look at, younger women, people with very dense breasts that have a family history that's really significant for breast cancer. Again, mammography, when the tissue is so dense, it's very hard to determine whether or not there's anything abnormal there. Pem, the dense breast tissue doesn't bother at all, so if there's abnormal cells in the breast, we'll see them. And again, we're at a level now that we can look at things, look at lesions that are in the 2 millimeter range, so very small.
At Northern California Pet Center, they offer both Pem and PET imaging to their patients. Technician Rita Bauer spent over a decade working with mammography and really sees the benefit of using Pem.
I like Pem versus radiography because the difference with metabolically visualizing images versus radiographically visualizing images is much clearer.
An advantage to using Pem imaging is decreasing the likelihood of false positive results.
Sometimes when we're looking at images with an MRI versus a Pem machine, they are termed false positives or true positives. False positives are sometimes images that can be seen and on biopsy are proven to be not malignant. True positives are we see it on the image and through biopsy are malignant. We see more true positives and less false positives.
Janet spends her days at Northern California Pet Center as an administrative assistant. More recently, though, she was here as a breast cancer patient. She can attest to the positive experience of using Pem.
I feel very strongly that in my case, I probably would be down this road 2 years from now because the other sites that were not detected on mammography and ultrasound were detected with the Pem scanner. In total, after completion of the Pem procedure, it was much easier than the mammography.
The Pem procedure starts with a safe injection of radioactive sugar and an hour of rest. The patient is then brought into a quiet room and seated in a chair. A typical Pem examination includes at least 2 scans per breast. The entire procedure, including the hour of rest, takes about a total of 2 hours.
It can be, I think, a very pleasant, quiet experience. You're allowed to lay your head down on a pillow while you're in the chair and it's over before they know it. And I have never had a patient complain about any discomfort with the compression. So it's been a really pleasant thing.
Advancements in imaging technologies like the Pem Scan will allow doctors to have access to the best information possible for their patients. It's not a question of which technique is the best, but what combination of imaging modalities will give the doctors and patients the advantage to make the best decision.